Hello and welcome to ECN. We deliver, you decide. COVID-19 concerns resurface as President Biden recovers amid rising infections.
Welcome to ECN Premium Digital News Channel. With President Joe Biden sick with COVID-19 and infections peaking again across the country, it's natural to ask, is COVID-19 still worth worrying about? The answer, yes and no. Yes, if you or someone you're likely to come into contact with is 65 or older, pregnant, or immunocompromised, or if you're headed to an event you don't want to miss, such as a wedding or a summer vacation. If you don't mind the possibility of getting sick, infecting others, missing a week of work, or slacking on other obligations or opportunities, then no. Every summer since the pandemic began in 2020, there's been a peak in infections, though it hasn't ever been as high as those in the winter. This summer looks to be the same. Wastewater surveillance data, which tracks the viruses we all shed when we go to the bathroom, has been trending higher for weeks, indicating that more Americans are carrying around the virus that causes COVID-19. COVID does not disappear the way influenza does during the summer, said Dr. William Schaffner, an infectious disease expert at Vanderbilt University School of Medicine in Nashville, Tennessee. It's like a two-humped camel. People travel a lot in the summer and spend time in enclosed spaces to get cool, he noted, which are all opportunities for the virus to spread. Not everyone will get sick if exposed to the virus, as we learned early in the pandemic. And most people, now that they've been vaccinated and infected at least once, won't get very sick. The virus is not new to our immune systems, as it was in 2020. But the people who can't mount a strong immune response to the virus, those with compromised immune systems due to age, sickness, pregnancy, or inherited problems, remain at risk of severe disease and even death if they get the disease. Although the federal government has stopped tracking COVID-19 deaths, someone dies every day from COVID-19 in New York City alone. Local hospital data shows people are not taking the appropriate precautions, said Dr. Seth Feldheimer, internist and associate professor of medicine at Columbia University Vagelos College of Physicians and Surgeons. It makes it more important to be fully immunized with the boosters. Biden is taking a break from the campaign trail to recover from COVID-19 after he tested positive Wednesday. At 81, Biden and his opponent, Republican nominee Donald Trump, fall into the group of about 60 million Americans at high risk of developing severe disease from the virus due to their age. The White House says the president is experiencing mild symptoms. However, health experts note that older folks are naturally more at risk than those under 65 because their immune systems are no longer as robust and protective as they once were. If you're going to pick one thing that is the most predictive of problems with acute COVID, age is the biggest risk factor, said Dr. Daniel Griffin, an infectious disease specialist and clinical instructor of medicine at Columbia University. As people age, their immune systems slow down and cannot respond to an invading virus as fast and strong as they once could, Feldheimer said. People 65 and older are also more likely to have underlying diseases that worsen with an infection. But the COVID-19 that older adults are getting is not the same novel virus that ravaged the country 4 years ago. In 2020, more than 300,000 people, 65 and older, died from causes involving the virus, according to the Centers for Disease Control and Prevention. In 2023, about 45,000 people died in that age group, according to data updated in September. However, this population remains by far the most vulnerable to the worst COVID-19 outcomes, accounting for about 63% of hospitalizations and 90% of deaths in 2023, according to a study published in October's Morbidity and Mortality Weekly Report. Staying up to date on booster shots and getting prompt treatment using the antiviral Paxlovid are the best ways to stave off severe disease in older Americans. Biden has technically had COVID-19 twice. He first tested positive for the virus in July 2022. He tested positive for a second time days after his isolation period in a rebound case. It's unclear if Paxlovid causes rebound cases of COVID-19, which can also occur without the medication. The CDC recommends high-risk patients take the antiviral, especially older adults. As evidence suggests, the benefits outweigh any risk of rebound effects. Thank you for watching and listening. If you like our content, give us a thumbs up and don't forget to subscribe and share our premium news channel, ECN. We deliver, you decide.
One choice can change everything. Say no to drugs.
Welcome to ECN Premium Digital News Channel. Life is full of important choices, and one of the most significant decisions we can make is to say no to drugs. While drugs might offer a momentary escape, they ultimately lead to a path of harm, stripping away our health, joy, and potential. Real wealth is found not in temporary indulgences, but in the strength and well-being of a healthy mind and body. Opting to live drug-free opens the door to a future filled with opportunities, achievements, and true happiness. Let's commit to making decisions that elevate us and those around us. By rejecting drugs, we are embracing life, health, and the myriad possibilities that lie ahead. Remember, our true wealth lies in our health, and each positive choice we make contributes to a richer, brighter future for ourselves and our community. Together, we can build a society where everyone thrives, free from the grip of substance abuse. One choice can change everything. Say no to drugs. Thank you for watching and listening. If you like our content, give us a thumbs up and don't forget to subscribe and share our premium news channel, ECN. We deliver, you decide.